In Ayurveda, osteoarthritis is correlated with Sandhivat. Sandhivat is a old age disease as after 45 years of age, our body has many degeneration changes in all type of joints. Especially our knee joint suffer more degeneration. In old age, Vata dosh get vitiated as our knee joint is weight bearing joint in our body as the whole body weight got put on knee joint. That is why our knee joint suffers more degeneration rapidly in comparison to other joints in our body. So, due to this osteoarthritis, people feel more pain and swelling in knee joint when he walks, run or sit, and it becomes difficult to patient to perform everyday household work. Under Panchkarma procedure, there is a procedure known as Janu Basti. For osteoarthritis disease, we have a treatment under Panchkarma procedure, that is Janu Basti. In Ayurveda, Janu is a Sanskrit name for knee. So here we will perform Janu Basti procedure for the treatment of osteoarthritis, or in Ayurveda which is known as Sandhivata. First of all, we will start with mantra chanting. We will chant mantra for God Ganesha and God Dhanvantari. God Ganesha is a symbolic of God of intelligence, who will give such intelligence to us so that we can perform our procedure without any obstacle and our patient get relief as soon as possible. Om Vakratunda Mahakaya Suryakoti Samaprabha Nirvignam Kuru Me Devo Sarvakaryeshu Sarvada. Om Shri Dhanvantare Namaha. Om Shanti Shanti Shanti. Our Janu Basti procedure is performed under three parts. First part will be Snehana, that means lubrication or abhyang to our knee joint, and second one is Sweden or fermentation, giving steam to the affected area, that is knee joint. First we will start with abhyanga Swedana or oil lubrication to our knee joint. We will take lukewarm telltale and then dip our fingers into the bowl and gently we will massage the knee joint. The telltale should not be heated directly on the stove. First we will take a pot and boil water in it. Then we will put our telltale in a cup and then we will put it into the pot which has boiled water, and that's how indirectly we will heat our oil. We have to gently massage the knee joint so that the oil get completely absorbed by the skin and the joint get lubricated deeply. We have to perform this procedure for about 10 to 15 minutes. The oil should be lukewarm in nature as it should not harm the skin or cause any burn to the skin. Here we are gently massaging or the knee joint. Here you can see a little bit swelling on the knee joint. And patient is feeling tenderness over here. So for the second part, we will do Swedana, that means fermentation. First of all, we will discard some water drops as they may harm the patient or they can cause burn to their skin. After that, we will check how much bearable is that steam. If it is too hot to bear, then we will wait for some time and we will tight our lid so that we can control the steam quantity. Here we will done this procedure for about 10 to 15 minutes. This steam should be given from 2 to 3 feet distance to the patient. The distance is very important to maintain as direct heat can cause harmful effect to the skin of the patient. This steaming process will relax the muscles around the knee joint and also it helps to reduce the stiffness of the muscles around the knee joint. For this fermentation, here we are using the Dashmul decoction. The herbs which is used to prepare the Dashmul powder is helpful in Vata dosha disease. They will pacify Vata dosha, hence we will use the Dashmul decoction for the steaming process. After the oil massage and fermentation process, we will do our main procedure, that is Janu Basti. For Janu Basti, first we will clear the surface of our knee joint. After that, we will take the acrylic mold and we will fix it on the knee joint. After that, we have here our wheat flour dough. This wheat flour dough is used to fix this mold on the knee joint so that without any difficulty or interruption we can do our Janu Basti procedure. So here we will take the dough and first make it like this as a rod and then in the shape of ring we will put it around the mold. In this way, we can stop the leakage of our medicated oil from this mold. Here we have fixed our mold with this wheat gram dough. In ancient time, traditionally we used black gram pulse to make this mold around the knee joint. But as the time passes, technology evolved, we can also use this kind of acrylic mold. It's become easier to fix on the knee joint and perform the procedure. We will first check the hotness of our medicated oil, as the oil should be in lukewarm state. Then after that we will gently pour our oil into the mold. First we will start by pouring our medicated oil around the sides of the mold. Directly pouring the oil into the center of the knee joint sometime may cause burn to the skin. That is why gently, step by step, we will pour our medicated oil around the corners of the knee joint. Here you can see our knee joint is fully immersed into the oil. Then we will gently move our finger into the mold in circular motion. We will let the oil into the mold for about 4 to 5 minutes. As we feel the oil get cold, we will get out the oil from the mold through the syringe. After getting out the cold medicated oil from the mold, again we will fill the mold with the lukewarm medicated oil. After getting out the cold medicated oil from the mold, we will again fill the mold with lukewarm medicated oil. We have to repeat this procedure for about 3 to 4 rounds to fill the mold with lukewarm oil and then getting it out from the mold as it gets cold. These 3 to 4 rounds will be completed in about 20 to 25 minutes. In this way, the oil will deeply lubricate the knee joint, and also the sound, crepitus sound that is used to come from the knee joint is also get reduced. This is the 4th round as we are getting our medicated oil from the mold out. And here we have completed our main Janu Basti procedure. And here we will gently remove our acrylic mold. After the main procedure, we will clean up the knee joint and then cover it up for some clothes and let the patient rest for about half an hour in the room devoid of air or any kind of strong ventilation. The best position for this Janu Basti procedure is patient in lying down position or in supine position. As our patient has some lower back issues, that is why we perform this Janu Basti on the patient in sitting position. But the best position to perform this Janu Basti procedure is the patient should lie down or should be in supine position. That is the best position for the procedure. And it's all about the Janu Basti procedure. Hope you have learned it very well, that how to perform Janu Basti procedure. Thank you. Hari Om.